Hey everybody, this is Halstead and Andrew McMillan with REH CPAs. Today we want to talk about healthcare sharing ministries. We all deal with health insurance and the rising costs of health insurance, and it can get really, really expensive. And one of the alternatives that has come up over the past 10 years in response to rising health insurance costs are these things called healthcare sharing ministries. I got Andrew McMillan here with me today. Andrew, what can you tell us about healthcare sharing ministries and their tax attributes?
Yeah, so they, like you said, they started some time ago, especially when health insurance was becoming more and more of a hot button topic. And they originally started out kind of in the religious world, where faith-based organizations where people of like mind would come together and share health sharing expenses, and kind of falls in line with some biblical principles, and taking care of your neighbor, things like that. So they originally kind of were born out of that vein, I guess, of allowing people to come together in a group and share medical costs in an affordable way. And that's the biggest piece of it. Oftentimes these healthcare sharing ministries are offered at a more affordable rate than your traditional health insurance, maybe through like Blue Cross Blue Shield or Aetna or some other larger conglomerate. So we've seen some clients want to start using this quite a bit, but unfortunately, as it sits right now, these healthcare sharing ministries are not considered traditional health insurance. So that means you cannot deduct these payment. They're not premiums, but you cannot deduct these monthly, bills that you pay for other people. You can't deduct those on your tax return. Those aren't a medical expense deduction. They're not a charitable contribution. And more importantly, for our business owners, they can't be used as the self-employed health insurance deduction. There's some push in Congress and through the legislature to try to get this changed. There is some push towards this, but there hasn't been any movement over the last few years.
So really what you have to do is you have to weigh the cost savings versus the tax deduction if you are a self-employed person, because the deduction can be pretty big.
It can be pretty big, so you do need to weigh that cost. If you need some help doing that, we can certainly help kind of talk you through what that might look like for you. But typically these healthcare sharing ministries were offered kind of in the religious realm, but they've really expanded now to where a lot of companies are starting to do these more, and it's a more affordable potentially rate that you're paying for some level of health care costs. But you essentially, you're a cash paying client. You pay cash when you go to the doctor. You submit those bills to your health sharing ministry group, and then you get reimbursement from other members throughout the year to help afford those bills.
These became really big back when they had the Obamacare, when that kind of came out, and if you didn't have health insurance, you got hit with a penalty. And if you had there was a carve out for these health share ministries. If you had one of these, it got you out of the requirement to have health insurance, and you didn't have to pay a penalty. So that penalty's kind of gone away, so it's kind of these aren't as attractive as they were back then, but still a really good option if health insurance, if you don't like how that health insurance market works, this is a really nice alternative to that.
Yeah, awesome. We've had a lot of clients use them.
Yeah. So if you have any questions on healthcare sharing ministries and how they're taxed or not taxed, feel free to give us a call and we'll help you out. Thanks.